Well, you've seen the overcrowded hospitals and the COVID ICUs. For nearly 2 years, you've seen many stories, but the nurses and doctors watching COVID hospitalizations spike higher than ever cannot look away. In the first of this series highlighting how a rural Wisconsin hospital is meeting the challenge, Naomi Coles goes inside SSM Health's Monroe Hospital.
This is nothing like flu season. We're trying to keep our heads above water here.
Some people are a little shocked. They're like, is that really happening here in Monroe?
In South Central Wisconsin, more COVID-19 patients are hospitalized than at any other point in 2021 by far. Here at SSM Health's Monroe Hospital, staff are daily facing a reality that for many in the outside world, they no longer want to meet.
Yes, it really is happening here in Monroe. What you hear in the news is true.
Each of their 6 ICU beds was full of COVID patients when we visited today. Their inpatient wing for lower-level COVID patients full, except this one.
This is the only empty room we have today, yep.
Which staff expected would fill in mere hours. The hospital is operating at a capacity far higher than it's staffed to cover, with staff that leadership say have helped keep the calm in their own community.
They have been so resilient in such a good, steady state that the community sometimes doesn't recognize how difficult the situation is. So when I go out and I'll speak publicly about what's going on, people are like, oh, I didn't realize.
But after nearly 2 years and now a surging crisis, the toll on patients and their medical teams is immeasurable.
I did have a lady who had lost a son, a brother, and her mother all to coronavirus. You know, that's a great impact on one family. And she herself had not been well either, so she could not go to any of those funerals.
You think to yourself, what am I doing wrong? How could I fix this? How could I prevented this?
Leaving staff with a message they want you to hear.
If you're able to, please get vaccinated.
This is real.
In Monroe for News 3 Now,
It's still going on. It's still a problem.
I'm Naomi Coles.
Our team spent nearly 4 hours in the hospital's ER, ICU, and inpatient wings today. Tomorrow, and in a special report on Sunday at 10, Naomi Coles is breaking down the reality of bed shortages, staffing crunches, and sicker patients as staff battle what they say is the worst it's been for them since the pandemic started.